Hi. Okay, so if I can ask you what your name is.
I'm Chris Ryan.
Okay, and where do you live then, Chris?
In Brighton, Kent Town, Brighton.
Right, okay. And what do you do for a living?
I'm a hairdresser.
Okay. And what made you come along to see Nigel and come to the Village Dental Centre for treatment? What were you concerned about?
Well, at the time I was a smoker and I was very unhappy with my teeth. They were very dark and stained. And I started bleaching them. Went on a bleaching system with Nigel, which was very satisfactory, and I got them up to a lovely Baywatch colour.
Good.
And then I wasn't happy with the shape of them. They were crooked and imperfected. So Nigel suggested, or you suggested, veneers, which I had to match up with the bleaching, which I was absolutely delighted with.
Good. And so how was the procedure? Was it difficult? Were the injections painful? How did you cope with all of that side of things?
Nothing was painful at all. I didn't feel any pain. It was a treat to get them done, and it was. I remember on one occasion I was in the chair for quite a long time. I think I dozed on.
I think you did. Okay, so when I put the anaesthetic gel on before we give you injections,
Yes.
does that help?
Oh, definitely, yes. I've spoken to other people who go to other dentists, and they say, oh, that injection is awful. And I can honestly say I've never ever felt an injection here.
Okay.
Because you seem to take about 20 minutes to put an injection in, whereas a lot of dentists just ram it in.
Get on with it. Yes. Okay. And how do you feel about the end result of what you've had done? Are you happy with the veneers and so on?
Oh,
they look pretty
I'm
good to me.
delighted. I mean, obviously I'm slightly obsessed with teeth because I've had this treatment done, and I notice everybody's teeth, and often I can tell straight away that they're veneers because you can see, the tops. But I feel that these have been fitted so well. I would say that you are not only a good dentist, but you are artistic with the treatment, and it's a very important consideration.
So would you have any problem recommending this treatment to anybody else who was a bit unsure, a bit apprehensive about having it done?
Go for it.
Okay. Thanks very much, Chris. Appreciate that.